Okay, social determinants of health beyond the clinic walls, why health begins where we live, work, and play. Learning objectives. By the end of this lecture, you should be able to define social determinants of health and discuss the 5 key domains. Explain how social determinants of health influence health outcomes. Analyze real-world examples of social determinants of health in clinical cases. And discuss the role of physicians in addressing social determinants of health. So what are social determinants of health? These are conditions in which people are born, grow, live, work, and age that shape health outcomes. There are 5 key domains of social determinants of health. So economic stability, this refers to employment, income, poverty, social class. Educational access, which includes literacy, early childhood development, how the patient understands his or her medical condition, and or yung educational attainment nila, among other things. Okay, healthcare access, this includes your insurance, proximity to clinics, and generally access to health. Neighborhood and environment, like housing, air quality, food deserts. Food deserts refers to places where there is poor quality food and there's little diversity in the food. This includes your sanitation, running water, yung presence of parks, for example, for where people can exercise, sidewalks for safety, built environment. Social and community context, this includes discrimination and social support. So when we talk of discrimination, this can be in terms of class, race, gender, social class. When we talk about social support, this is kung kanino lumalapit yung family sa panahon ng kagipitan. So economic stability and health. Low income leads to limited food options, which increases the risk of obesity. Job insecurity leads to chronic stress and hypertension. Life expectancy can vary by 20 plus years between wealthy and poor neighborhoods. So when we have low income, you have limited financial resources, the patient is unable to buy quality food, or the patient nagigipit, so yung kung ano lang yung mabili niya, and this in turn leads to malnutrition. So an example of this before was the taekwondo coach and his daughter who lived off of Lucky Me Pancit and noodles for 2 years, and eventually they developed chronic kidney disease and almost died. So this happened not too long ago. Education as a social determinant of health. So low education leads to higher smoking rates and lung cancers. And poor maternal education leads to low compliance with child vaccinations and an increase in your vaccine preventable illnesses. Neighborhood and built environments. So food deserts leads to increased diabetes prevalence kasi low quality food. Pollution leads to exacerbations of asthma. Lack of sidewalks leads to less walking and decreased cardiovascular fitness, which in turn leads to cardiovascular disease. So all of these are examples of neighborhood and built environment as a social determinant of health. Social context and discrimination. So an example would include racism, which leads to chronic stress and cardiovascular disease, and LGBTQ plus stigma, which may lead to mental health disparities, which can be in the form of your anxiety, depression, etc. Social determinants in health and clinical practice. So in clinical practice, we can use screening tools like your PROPARE, which is a protocol for responding to and assessing patients' asset, risks, and experiences, and the 2-question screen, which is primarily used for anxiety and your depression. Interventions that can be done for social determinants of health could include referring to social workers, food prescriptions, housing assistance, referral to agencies that can offer social support, like politicians, for example, Office of Politicians, religious groups, and of course your NGOs. Okay, why should doctors care? There's an ethical duty to first do no harm. This includes addressing the root causes. There are practical reasons because social determinants of health drive avoidable ER visits and readmissions. And treating the disease without addressing social determinants of health is like mopping the floor while the faucet runs. So, short case study activity lang. So, a 10-year-old girl frequently misses school due to frequent attacks of asthma. Sorry, nakalimutan ko yung asthma dito. Due to frequent attacks of asthma. So, social determinants of health includes your poor housing, mold, dust, chemical irritants, and pollution near the home. And the interventions would be to wear face masks, replace moldy boards, repair and or clean pipes, roofing, and gutters, and refer to a social worker if necessary for rehousing. So take-home message, health is more than medical care. It is shaped by social conditions. Screen for social determinants of health to provide holistic care and advocate for policies addressing inequities. And these are my references and resources. Thank you.